Welcome, friends. It's nice, and we are very happy to have Dr. Ash with us today. And it's our honor. Thank you, sir, for taking time out for us and giving us, guiding us through this session today. And I will ask Dr. Alphonse now to welcome Dr. Ash, and then we can start with the program.
Thank you, Dr. Vanita, for inviting me. And it's my great privilege and honor to introduce and present one of my most favorite professors and teacher from my early years, Professor Dr. Gautam Ash, who is a senior administrative grade professor, who's a former director in charge and professor and head of Department of Anatomy and Pediatrics. Though he is formally retired from NIH 2019, but still he continues to teach in NIH. That's what I understand, and very happy that his passion he is continuing, because we all know right from our earlier days of BHMS, the first year anatomy, he used to teach anatomy and then many other subjects. So we have always seen his passion in teaching. Now presently he is pursuing also PhD at West Bengal University. I don't know whether he has completed, and
no, not yet completed.
Okay. I know PhD is a long process. So
because of the COVID situation, last years everything was locked down. University also work was stopped.
Okay. So anyway, all the best. Yes.
Another problem is there because Dr. Dilip Patakada was my guide. And now he has retired. So now I have to get a new guide afresh in his place as per university norms. So I am searching that who will be a full-time teacher under the University of Health Sciences.
West Bengal. Okay.
So it will take little time. After that, my half of the work is over. Even the first part, research methodology part is over. That I have passed and I appeared in the exam and I have come cleared up. Only
now your thesis presentation.
Yeah.
And talking about introducing Dr. Gautam Ash will not be complete without mentioning his tenure and contribution at Father Muller Homeopathic Medical College, where he joined in 1986 when the college was only a few months old. Probably he's one of the earliest faculty members in the college when it started. There he started teaching anatomy, and then also he taught surgery and therapeutics and materia medica. And as a passionate teacher he loved teaching anatomy, as he says even now. Without the dissection and histology, embryology, he cannot survive. His day is not complete. So he had a tenure of 8 years at Father Muller Medical College, and his contribution to the development of the college has been immense. And then he moved to NIH, that is National Institute of Homeopathy, in 1994. That was a great loss for Father Muller's, but a gain for NIH, definitely. And then he resumed Department of Anatomy as a assistant professor, and then also he started teaching pediatrics, and then he became eventually the head of the Department of Anatomy and Pediatrics, and finally he retired in 2019 December as the head of the Department Pediatrics and Anatomy. And he was the former director in charge of course, of National Institute of Homeopathy, which is an institution under autonomous institution under Department of Ayush and Government of India. And his academic and other administrative capacities, he has been the member of Board of Studies, both UG and PG, and Review Committee in University of West Bengal, worked as a member of several committees, including Institutional Ethical Committee, Nodal Officer for Reorientation Training Program, amongst the several homeopathic medical colleges in India. And he's contributed to the syllabus formation of UG course in anatomy and forensic medicine toxicology, for the BHMS course in anatomy, and diploma courses in homeopathic pharmacy. He's been the director in charge, as I mentioned earlier, during that tenure, he's undertaken responsibilities as academic in charge and several additional charges, as central vigilance officer, maintenance in charge. Also, he's worked as the adjudicator for evaluation of MD homeopathy program at Rajiv Gandhi University of Health Sciences, Bangalore, Karnataka. He's been the examiner, paper setter, moderator, head examiners for various University of India. As a academician as well as a great clinician, he's got a vast experience in treating cases, and as I remember his anatomy classes, he always give importance to the applied anatomy. So those days we did not understand much because applied anatomy or surgery was not our main thing was dissection. But then we came to second year, third year, we realized what is applied anatomy. So that is the clinical aspect he started introducing when we were in the first year itself. So anatomy, when you talk about liver, he would tell about the diseases of liver, though we did not understand much. But later in clinical practice, how much importance it is. So he is the right person to deal with any clinical condition. When we always approach him for any webinar, he'll say, okay, tell me which subject you want, what topic you want, you choose, he says. So that has been his, it shows his vast experience in clinical application. So today we have very fortunate to have him to deal with the subject of acute gastrointestinal diseases and its therapeutics. Probably we will expect him to tell us what medicine to introduce at what stage and how important it is to take a abdominal case, mainly GIT. So without further delay, I very glad to introduce and present Professor Dr. Gautam Ash. Sir, please take over.
Okay. I'm taking the share screen, okay?
Yes, please.
Yeah, good afternoon to everybody. Now, today the topic which I'm going to take up is therapeutic aspects of acute gastrointestinal disorders. Now, thing is that gastrointestinal disorders, whether it is acute or chronic, doesn't matter, because sometimes the chronic case could be acute, or acute on chronic, or chronic on acute, or there may be relapsing stages. Therefore, whatever may be the case, or whatever may be the condition, or whatever may be the disease, we have to take it as a fresh one, being a homeopathic practitioner or homeopathic physician. Let us start with the GI disorders. Gastrointestinal diseases are among the most common problems in tropical countries like India, Bangladesh, or any Asian countries. Commonly manifest are as a diarrhea, constipation, abdominal pain, abdominal distension, gastrointestinal bleeding, could be internal, could be external, or could be with the hematemesis or due to melena, intestinal obstruction, intersusception, malabsorption or malnutrition, etc. So these are a few of the conditions other than many conditions which could be acute or could be a long-term problems or could be chronic one. It could be infectious diarrheal diseases which are an important cause of morbidity and mortality in childhood. Certain gastrointestinal disorders can be life-threatening and require emergency treatment. When we'll be discussing about the management part of the gastrointestinal disorders, that time we'll see which condition can be treated homeopathically or how far to treat homeopathically, or when to treat homeopathically after the patient will be coming from the other hand, that will be discussed. Most common signs and symptoms of any gastrointestinal disorders are abdominal discomfort. That is the bloating, pain or cramps, which we appreciate or which we feel. Unintentional weight loss. This is usually for any condition which will be progressing either slowly or fast progressing, leading to unintentional weight loss. Vomiting and nausea, which are one of the most common symptoms. Then acid reflux or the heartburn. Diarrhea, constipation, or sometimes both diarrhea and constipation, or alternately diarrhea and constipations, which will indicate a kind of disease which are seated or deep-seated or autoimmune in the intestinal tract of our abdomen. Then fecal incontinence and fatigue state of the fatigue state and loss of appetite, etc. Now, experiencing alarming or discomforting issues associated with digestion and or experiencing pain and discomfort in mouth or throat or abdominal region or in rectum could be nothing or maybe an early sign of gastrointestinal disorder.
Gastrointestinal.
Typhoid increases if anyone experiencing symptoms such as gas or bloating or a burning sensation in chest, nausea and vomiting or pain when passing bowel movements. GI disorders or gastrointestinal disorders are conditions affecting organs that are part of the digestive process from mouth to the rectum and the accessory organs of digestion, that is the salivary glands, liver, gallbladder, pancreas, particular. So all are affected by gastrointestinal disorders or any part of the digestive system, including the digestive tract and the accessory organs or the digestive glands. When they will be affected by any disease, that will be coming under the gastrointestinal disorders. Not all gastrointestinal disorders are life-threatening, as we know, and most are preventable through a healthy lifestyle and regular screenings. This is done by all of us. Anybody comes with hyperacidity or reflex esophagitis, or we may get some ascites, or we may get gastritis, or any other diseases like cholecystitis or constipation, diarrhea. So some area or some conditions are not life-threatening, or all the conditions are not life-threatening, and most of the cases are preventable through a healthy lifestyle and regular screening method. But screening is very important. Without screening, we cannot say that it is preventable, it is curable, or we may go for palliation of that state. Most of the time, a gastrointestinal disorder is nothing to be alarmed about. Many such disorders have obvious causes. Every such causes can be taken care of, maybe exciting or fundamental causes, or maybe maintaining causes which we have to remove or which have to take care of and can be fixed easily. However, there are disorders that could lead to complications if left untreated. Naturally, all the gastrointestinal disorders are required to be treated, maybe for a long term or maybe for a short period, but or maybe taken into account for preventive measures, or the influencing factors or the precipitating factors are required to be removed to make the patient healthy or to have a healthy life. However, symptoms can overlap, which means the only way to protect our health is by getting an accurate diagnosis. This diagnosis is very important. What is diagnosis? Diagnosis will give us the exact picture of the disease, the cause of the disease, the prognosis of the disease, and the future complications if we don't treat that. Therefore, accurate diagnosis is very important. Depending on the diagnostic results, assessment of an acute issue, what is the topic today, or a chronic one, can be made for proper management of the case. Therefore, diagnosis of any of the conditions are very, very important. Now, let us come to the management of GI diseases. There are so many diseases, but we cannot go one by one diseases. It will take so much time and different approaches to be taken. But I will be giving a common method or a common pattern, or I'll take a common management pattern by means of which we could treat the diseases after getting the diagnosis. If experiencing mild GI symptoms, that means gastrointestinal symptoms, that may not be required any medical attention. That can go automatically. But if the symptoms persist for a longer than a few days, disrupting day-to-day life and not caused by an exciting illness, definitely it required a treatment. So let us see what could be the management guideline. First, we will be dividing into two aspects. One is the conservative measures and other aspect is the specific measures. Conservative measures for all the cases, if can be taken or it can be done. Specific measures wherever it is required, or after getting the diagnosis, we have to decide whether we will be sending the patient for a specific treatment or for a particular treatment initially or after some time, after giving some period of time treatment by our medicine. Anyway, conservative treatment again are of two types. One is general measures and medicinal measures. General measures depends upon the case, and medicinal measures, that is by our homeopathic medicine. The medicines could be acute and subacute, or it could be constitutional, or it could be intercurrent medicines. Now let us see one thing, that homeopathic medicines are so many are there. Some medicines are meant for acute conditions, some medicines are meant for constitutional, and some are intercurrent. When we will be seeing that acute or subacute or constitutional medicine, after giving those medicines, some sort of improvement has occurred, but we are getting relapse of the case, or sometimes we are getting that the condition is getting improved, but somewhere it is halted. Then after analyzing the case, after seeing the diagnostic and prognostic data, when we will be getting that due to some blockage somewhere, which are nothing but the miasmatic blockage, the medicine cannot act properly, or action of the medicine is halted. In that case, sometimes we have to give some sort of intercurrent medicines to remove that block, to remove that miasmatic block. After that, again, some medicine will continue and it will give a permanent cure or relief to the patient. Accordingly, based on acute, subacute, constitutional and intercurrent medicines, I will be telling you how the approach will be done in case of GI conditions finally. Now, specific measures vary from condition to condition and person to person, because it depends upon somebody is suffering from cholecystitis with severe flare-up of the symptoms like vomiting, abdominal pain, fever, diarrhea or anything, a loss of appetite. But some people are having recurrent cholecystitis or with gallstone without any symptom or without much aggravation of the symptoms. Therefore, we may say that specific measures are variable from condition to condition and person to person. Sometimes a person is suffering from multiple gallstone or suffering from ascites or cirrhosis of liver or ulcer, where there is ulcer means peptic ulcer, but cannot be sent for surgery, though it is required due to ill health or due to some other problems, when the patient cannot be taken for surgery or cannot be taken for any other procedures. Naturally, we have to depend on the conservative measures based on general measures. That means what all factors will be removing, or the diet and regimen to be given to the patient, and followed by the medicines, time to time changing the medicines, give relief to the patient. However, the specific measures could be again conservative, operative, or combination of both. So this is the general plan for any GI disease when we are taking for a treatment. But before going to the management proper, I am just giving a group of medicines which are very commonly used for certain GI diseases in acute as well as subacute and chronic stages. Homeopathic medicines commonly used for treatment of GI diseases. For acidity, indigestion, gas, pain, abdomen, etc. You must be knowing all these drugs, and you have already used those drugs, and we are frequently using these drugs, especially in the acute conditions, or sometimes same medicines will be taken for constitutional treatment, and some of the medicines are also taken as an anti-miasmatic, which are clearly meant for removing the blocks. Like Nux vomica, carbovage, arsenic album, pulsatilla, lycopodium, antim crude, phosphorus, argentum niticum, anacardium, natrum news, natrum sulf, then Ethuja cyanopium, iodium, sulfur, silicea, rubenia, Azadiracta indica. These are Indian drugs. Azadiracta indica, Carica papaya, Embalia ribes, then Gentiana chirota, Colosynthis, Diascorea, Belladonna, Chamomilla, Plumbum, Magphos, then Carduas marinus, Chelidonium, etc. There are so many medicines, but I have just given a few which are commonly used by homeopaths for treating acute GI problem as well as chronic GI problems. But mostly I have given those medicines which are used for acute conditions because my topic is acute GI problems. For vomiting, similarly for vomiting, Ipecacuanha, then Nux vomica, Ethuja, arsenic album, phosphorus, Oculus indica, petroleum, pulsatilla, veratrum album are the medicines which are very frequently prescribed. Similarly, for diarrhea and acute gastroenteritis, arsenic album is one of the most important drugs, followed by alosacotina when patients are going frequently to the toilet and unable to resist the passage of the stool. Then podophyllum, since morning patients started going to toilet and they are suffering from the morning diarrhea. Veratrum album, then China, Croton tea, pulsatilla, Nux vomica, Maccarb, Natrum carb, then Ethuja, antim crude, rheum, phosphoric acid, phosphorus, argentum niticum, sulfur, chamomilla, camphor, cupramate, Ipecacuanha. All these medicines are used for diarrhea and acute gastroenteritis. I am 100% sure that from these medicines, the medicines are used for these conditions when you are practicing. For dysentery also, aloes, Maxol, Marcor, Cantharis, Colchicum, Ipecac, arsenic, all these medicines, and a few medicines like Curchi, Atista indica, Blumia odorata, Chapar, Eagle Eagle marmelas, these are also very important and used for these conditions. For constipation, similarly, these are the group of medicines which are used. Similarly, for peptic ulcer, so many medicines already given in the PowerPoint. These medicines are very commonly coming. Then for hematemesis and melena, Geranium maculatum. Then arnica. Arnica is given when there is injury to the abdominal viscera, followed by melena or hematemesis. Then arnica comes. Otherwise, Ipecac, millefolium, phosphorus, China, carbovage, Portella sordidus, arsenic album, Calivi, all these medicines. I am not going to discuss the drugs and their symptomatology. but I will be telling you how to select the medicine and how to prescribe the medicines. Let me give you the list of the drugs, then let me tell you the homeopathic philosophy and mode of treatment part, followed by we'll discuss if required, because the indications of all the medicines are known to all of us. Naturally, it will be it is not necessary to waste our time in discussing the symptomatology or indications. As for example, bryonia. Whenever bryonia or nux vomica or sulfur or anything will be given for constipation, particular symptom to be taken care initially, but generalities is must. Though some diseases, particularly the acute conditions, are one-sided. In case of the GI problems, and it is projected with only a few symptoms, but as a whole, we have to try, being a homeopathic physician, we have to try to get the totality of the case, taking both mental and physical generals, as well as the characteristic particulars. If we get the peculiar, uncommon, rare pictures, then it is very, very easy to give relief to the patient, and that is homeopathy, and that is the role of therapeutic part or therapy from homeopathic point of view. Anyway, for jaundice and gallstones, some drugs are given, which are also very useful. These drugs are known to all of us. Then cirrhosis of liver. For cirrhosis of liver, these drugs are also very useful and known to us. Then for ascites, like apis, apocyinum, arsenic, acetic acid, lycopodium, colchicum, these are useful. But we have to see when to treat with only homeopathic medicines. That is the reason I have given the total chart of the management, like conservative and the specific measures. During the specific measures, if it is a case of huge ascites, we have to tap the, or we have to do the parasynthesis of the ascitic fluid. We have to go for laboratory investigations to see any cells, abnormal cells are available or not, for diagnostic purpose. And along with this parasynthesis of the abdominal collection of fluid, we have to give medicine. So both things has to be done together. This is an emergency condition. Therefore, we have to take care on emergency basis. That's why I have given a caption beforehand that all the GI diseases are not life-threatening, but some are life-threatening if not treated in time or if not taken care in time, and then it will be leading to the emergency, or it can be treated as emergency basis. Similarly, for gastric carcinoma, some drugs which are there, you must be knowing that Condaringo, Hydrastis, Bismuth, Asterias rubens, these are very important for gastric carcinoma. Then for pancreatitis, this is another important GI problem, which is very life-threatening, really life-threatening. It could be acute, it could be chronic, it could be hemorrhagic, and it is the pain in acute condition is very, very difficult to tolerate. Therefore, it is also a case of emergency. Then ulcer of mouth and tongue. These are the cases which could be managed with only homeopathic medicine and with some of the general measures, like not to take very hot food, not to take very hot drinks, not to take spicy food, and to take give mouthwash, all this. For bleeding per rectum, this is also a case where the Marksol, Markor, Hemamolis, Millifolium, Collinsonia, Retinia, Sulfur, Graphitis, Thuja, Phosphorus, all these medicines are very, very commonly used. So these are certain group of medicines which are given for most common GI conditions, but I'm not going for the indications. If required, will come later and at last. So as we have given the management part in detail, like conservative and specific measures, again conservative, we will be giving medicinal, general measures, again medicinal measures. We have seen that the medicines are given as an acute medicine, subacute medicine, constitutional medicine, or intercurrent medicine. Again, we have seen that in specific measures, we may go for conservative, operative, or combination of both. So which part of the therapy will be taken or which measurement will be given for a particular condition, to understand that, we have to see first what all diseases are there in the coming under GI system, and what all diseases are functional, what all diseases are structural, what all diseases could be prevented easily, what all diseases could not be prevented easily, what all diseases could relapse, and that time what could be done can be taken. So before going to have our treatment part, or the mode of treatment part rather, let us see the gastrointestinal diseases in detail. What is it? What are the types and examples of that? Very common, of course. So gastrointestinal diseases refer to diseases involving the gastrointestinal tract, starting from mouth to the anal canal, and the accessory organs of digestion, which are nothing but the salivary glands, liver, gallbladder, and pancreas. You must be well aware that salivary gland is secreting saliva, which is important for digestion of the carbohydrate inside the mouth, especially the starch part of the carbohydrate, simple carbohydrate. But again, within the salivary gland, the duct may have a stone formation. Within the duct, there may be stone formation. If there will be stone in the duct, then it will be a problem. Or if there will be a tumor to the salivary gland, that will be a problem. Similarly, for the liver, we are knowing that hepatitis is one of the important disease. Then again, liver abscess is another important disease. Then cirrhosis of the liver, fibrosis of the liver, and initial stage of cirrhosis, fibrosis is the fatty liver. So if we are knowing the initial stage, then we may treat to halt the disease. So naturally, how to halt, what will be our therapeutic approach? We are going to come one by one. Before that, let me discuss about the GI diseases in detail. Now, function of GI tract. Let us see why we are going to treat the diseases, why the diseases are impeding the functions of the GI tract. So let us see the normal functioning of the GI tract. GI tract, it is responsible for ingestion of food, propulsion of food and waste from the mouth to anus. That means the normal peristaltic movement. By this movement, the food passes from mouth to the mouth to esophagus, through esophagus to stomach, then into the intestine. Then from the intestine, after digestion, absorption, the waste product will be accumulated in the colon, and in the colon means sigmoid colon and rectum. Finally, it will be going out through the anus. Secretion of mucus, water, and enzymes. This mucus is secreted by the epithelium lining the intestinal tract, or lining the gastrointestinal tract rather. Then water, then enzymes, mostly secreted by the glands. Then mechanical digestion of the food particles, starting from chewing in the mouth. Then churning movement of the stomach, mixing with the enzymes, digestive enzymes. Then chemical digestion of food particles by different enzymes coming from the stomach, coming from the duodenum, coming from the intestine, then also coming from the liver, pancreas, then absorption and assimilation of digested food. This is another important function of the GI tract. Elimination of waste products by defecation. So any of the functions, if will be hampered, either one or more than one functions will be hampered due to some condition, we have to take care of that. Otherwise, the symptoms which you have shown earlier, the signs and symptoms, that could occur at any level and any time at any gravity. So GI diseases are manifestations of alteration in nutrient assimilation. The functions, when it will be altered, then the GI diseases are there, or due to the alteration, GI diseases, or diseases are due to the alterations, whatever you say. Then waste evacuation, or in the activities supporting the following main functions. So what all main functions are there, if that will be altered? What are these? Impaired digestion and absorption, altered secretion, altered gut transit, that means peristalsis. Retrograde peristalsis, when vomiting will be there. I can give you example. Take a case of appendicitis. Take a case of appendicitis. We know from our surgery knowledge, from our anatomical knowledge, from our medicinal knowledge, that appendicitis is one of the very, very common acute abdomen condition. Or it is one of the acute state of the gastrointestinal disorder, where the appendix will be inflamed. Now, within the appendix, due to the presence of the abdominal tonsil, that means the lymphoid nodules, they will be trapping the infective materials or the infective materials, and due to that, it will be inflamed. We know that appendix is not doing any digestion for us, for human being. It is important for the rabbits because appendix is meant for cellulose digestion. We are not herbivorous, so it is not that important for us, but it is giving trouble. In what way it gives troubles? The appendicitis could be acute appendicitis, could be subacute, could be chronic, or if there will be a lump formation. All these states are very dangerous, especially the acute appendicitis. Why I took it? Because our topic is acute condition of the gastrointestinal disorder, acute gastrointestinal disorder. So in case of the appendicitis, what is going to happen in the acute state, if we don't take immediate surgical measure, it may go to complications. What all complications? There may be necrosis, there may be rupture, there may be abscess formation, or most commonly, we are going to see that if we don't treat it, there will be appendicular lump formation. And once the lump formation will be there, then the patient will not be able to go for surgery for another minimum 4 to 6 months. The patient will not be able to do his normal work, normal food, cannot take normal food for another 4 to 6 months, until and unless that lump will be reduced. Because once the lump is formed, surgery is not possible because the area will be highly friable. So once operation will be done, instantly there will be rupture of the or damage to the gut and the appendicular lump due to friability. Moreover, the abdominal policeman, that means the peritoneum, will try to localize the infection of the appendicular lump by having some sort of wrapping the area to give protection. So naturally, the patient will be in the bed for 4 to 6 months until and unless the appendicular lump will be resolved. Then only the patient will have to go for interval appendicectomy. So see this case. Why I have taken this case? Because, as an example, because if we don't treat in time, maybe conservative way or maybe operative way, but our first and foremost choice will be operative. This is as per our knowledge of appendicitis and knowledge of the complications which will arise due to appendicitis. Again, appendicitis are of different type. Appendix, as because their position is different. So appendicitis will give different type of presentations or expressions, what we say from homeopathic point of view, or symptoms and signs. Sometimes we'll be getting that there will be severe vomiting. Why severe vomiting? There is a type of appendix which will be 2 o'clock position, and that too pre-ileal position. 2 o'clock means just in front to the terminal part of the ileum. Due to inflammation of the appendix, it will be irritating the terminal part of the ileum in front, as it is passing in front to the terminal part of ileum. Due to the irritation, there will be altered peristalsis. Peristalsis usually grow from above downwards, from the stomach towards the rectum, anal canal, but here it will be just reverse due to irritation to the terminal part of the ileum. As a result, what is going to happen? There will be severe vomiting due to reverse peristalsis. this actually to mention about altered gut transit, I have to take the example of the appendicitis and to tell you that there are so many types of appendix depending on the position or direction of the appendix. It could be 11 o'clock, could be 12 o'clock, could be 2 o'clock, could be 3 o'clock, could be 4 o'clock, could be 6 o'clock. If it is 6 o'clock, then it is towards the pelvic cavity and directed towards the rectum and the urinary bladder. So inflamed appendix will be irritating the urinary bladder. It will be irritating the rectum. As a result, patient will feel to go toilet repeatedly. So it may give us an impression that Nux vomica is the medicine, but we will not know whether this condition is due to the appendicitis or not. So to know this, that it is a case of appendicitis and that too the appendix situation wise is 6 o'clock position, that means it is directed to the pelvic cavity perpendicularly or vertically down, irritating the gallbladder, irritating the rectum and urinary bladder. As a result of irritation, patient is feeling to go to toilet again and again. So the Nux vomica will not be given or will be given, that we have to judge. Here is the therapeutic value, the way or the process by means of which we will select the medicine based on the type of the disease which is there as an acute condition. So here is called altered gut transit. Again, if it is a case of appendicitis, which is common appendicitis site is common type is the 11 o'clock position or 12 o'clock position, 60 to 70% of the cases. There usually what happens, the pain will be located ultimately, initially whole abdomen, followed by to the localized in the right iliac fossa. But in other case, we are getting severe vomiting in 2 o'clock position by due to irritation. If it is a pelvic type or if it is 6 o'clock position, then patient will go frequently to the toilet for defecation or for urination. If it is so these are different types what we are telling. Again, if it is a 4 o'clock position or 4 o'clock position, then what happens? It will irritate the inguinal ligament. As a result, pain will be radiating to the thigh. So once pain is radiating to the thigh with pain abdomen, we may not think that it is a case of appendicitis. We may think the pain is coming from something which is giving pressure or from the iliolumbar region or from the by compression of the lumbar plexus. So we will be misguided. So naturally, we have to have some sort of ideas about what is the disease, how to know it, by the diagnostic aptitude. That's what we have told, that without diagnosis, we cannot know the prognosis, complications, and naturally, we cannot decide the mode of treatment. Anyway, let us go forward. Immune dysregulation. Immune dysregulation. Suppose anybody is taking milk in any form, maybe a tin food milk, or maybe from the cow milk, or maybe from buffalo milk, whatever may be. Whenever the person takes milk, especially the kids, as well as of the adult, mainly the children, but adolescent or adult persons also may get some sort of allergy, which is called as lactose intolerance. So this milk has got common carbohydrate. That carbohydrate will be allergic. Once it will be coming into the gut or the intestine or into the GI system, there will be allergic reaction because the person has got an immune response. This immune response is nothing but the allergic response or hypersensitive reaction. As a result, patient will have diarrhea, constipation, or vomiting, or discomfort, bloating of the abdomen. Anything can occur, which is called as lactose intolerance. So this is immune dysregulation. Then colitis, ulcerative colitis particular. This is also autoimmune disorder. Crohn's disease, this is also autoimmune disorder. Colorectal carcinoma, that is also a case. Colon and rectum both are involved. So colorectal carcinoma, once the gluten of the wheat or maida, which are available in the wheat or maida, is taken, then there will be an autoimmune reaction by the epithelial lining of the colon and intestine, and large intestine as well as the rectum. As well as what will happen? The epithelial lining will be damaged. So the function of the gut is going to be impaired. This is called as colorectal carcinoma. The process is very slow. So we have to have some sort of knowledge about the diagnostic aptitude. Let us come to the other areas like neoplastic degeneration, any polyp, polyp of the colon, colonic polyp. Initially, it will be collection of the cells. Later on, this polyp will be converted to carcinoma, called as colonic carcinoma or carcinoma of the colon. So naturally, neoplastic degeneration. Then disorders without obvious organic abnormalities. Functional. This is functional. There is no such structural changes within the gastrointestinal tract or the accessory digestive glands. But patients will suffer from vomiting, acidity, constipation, diarrhea, or anything else. So these are called disorders without obvious organic abnormalities. Genetic influence. This genetic influence is another factor which is very, very, or better to say highly important. Colorectal carcinoma is one of that. Genetic, which are hereditary diseases. So naturally, these are the activities which are supporting or which are altering the functions, or due to this, these are the altered function due to the nutrient, what I should say, malformations or alterations of the GIT. Now, types of gastrointestinal disorders or diseases. Let us see how many types are there and which can be prevented easily, which has to be taken care very rigidly, or where relapse case will be there, where complications could come. So we have to have some other mode of treatment associated with our treatment, either initially or after giving treatment for some period of time. Then we have to refer like this. So types of gastrointestinal disorders are of two types. One is functional, other is structural. Now see, we have always seen that scope and limitation in homeopathic practice. Whenever any case comes to us, any disease comes to us, what we do? Initially, after taking the case, we are doing a provisional diagnosis. Why provisional diagnosis? Because apparently we have to see or think what type of case it is or what is the case. After that, to confirm it, we have to have some sort of laboratory investigation. Once we will be having confirmation of the case or diagnosis, then what we have to do? We have to formulate the treatment part. Regarding formulation of the treatment part, first we have to find out, whatever things I have discussed so much just now, we have to see that whether it is a functional case or it is a structural, there is a structural change. If there is a structural change, whether it is reversible or irreversible. If it is reversible, when to take the action and how far it will be reversible. If it is irreversible, what could be our mode of treatment? By any medicine, the same list of medicine will be given. Maybe in the low potency, maybe in the mother tincture form, maybe in the high potency, depending upon the condition of the patient. That's what we have mentioned, variable or varies from case to case, person to person, condition to condition. Anyway, so there are two types of gastrointestinal disorders. One is functional, other is structural. Let us see about the functional first, then we will go for the structural one. What are functional types of the gastrointestinal disorders? These are those disorders which are characterized by chronic or long-term GI symptoms, gastrointestinal symptoms. Already I have told you, or already I have shown you in the very beginning what could be the common GI symptoms that arise due to the function or dysfunction of the digestive system. Could be due to function, could be due to dysfunction. Then common problems and very common among pediatric age group. Functional changes are mostly common for the pediatric age group. There is no such structural abnormality seen in the GI tract, but not functioning well. Though there is no structural changes, but the tract is not functioning well. That is why the disease is produced or the symptoms or signs are coming. When we go for X-ray or endoscopy or any test, here it is written blood test. Why only blood test? Even stool test will not give any abnormal result that can be associated with this symptom. This type of conditions, in this type of conditions, GI tract looks normal when examined by, but does not move properly. Though normal, I was talking little bit earlier that peristaltic movement is impaired or retrograde. Though there is no underlying physical cause, but can severely affect a person's life. Suppose a person is suffering from hyperacidity, or a person is suffering from dyspepsia, or a person is suffering from diarrhea or constipation. There is no such obvious cause, but the patient is feeling very bad, or patient is severely affected by those conditions for a long time, for a period of time. That will hamper the person's regular life, day-to-day life or activities. The functional conditions are characterized by persistent and sometimes embarrassing symptoms. Same thing what I told just now. Can often be treated with lifestyle change, as because it is functional, so no need of medicine even. If we go for dietary change or some sort of adjustment in the diet, or suppose somebody is suffering from a hyperacidity regularly, especially when the person will be stressed, when the person will be in anxiety, or the person is anxiety prone, very much emotional. So here hyper secretion of the acid is going to be there. So now the patient has to, no need of taking medicine initially, but the patient has to cope up the situation so that the acidity will be reduced. This is called lifestyle change, or some sort of dietary change has to be done if diet is the cause. Though harmless functional conditions, but important to be screened to rule out a structural disorder or something more serious. Though apparently some cases, suppose a person is suffering from hyperacidity regularly, or telling that I am getting acidity every day in the evening. The moment I take lunch during the daytime, and slowly what I get that my abdomen is getting full or getting bloated, gas is accumulating, and at the time approaching to the evening, I am getting that my abdomen is fully swollen. I don't feel to eat anything. I am feeling uneasiness. I get some sort of sour taste in the mouth. If I pass some sort platters, then it gets little bit relief for temporarily. Again, when time passes slowly, at night, slowly by passage of platters or by passage of the wind, I am getting to some extent better, and around 9 o'clock, 10 o'clock or 11 o'clock at night, I get appetite and I take food. So it is a clear-cut indication of lycopenia. And here, if we screen the case, if we do all investigations, if we take the whole history, we may not get any structural changes, but we get, due to the functional changes, this thing has occurred. Again, maybe due to some sort of structural changes, this thing is happening. Maybe due to fatty liver, maybe due to gallbladder problem. So if we screen that, or we have to screen the condition, though we are thinking it is a functional, but whether there is any structural changes or not, that has to be ruled out. Otherwise, in long term, it will be serious. So the common symptoms of functional gastrointestinal disorders are abdominal pain, cramps, bloating, gas, diarrhea, constipation, incontinence, etc., etc. These are very, very common. So only based on these areas, we cannot level the person that this person will have a structural change. Examples of the functional disorders of the gastrointestinal conditions are nausea, food poisoning, gas, then bloating abdomen, GERD, gastroesophageal reflux disease. This is one of the most common condition and very, very difficult case to treat, but we have to treat it. Then chest pain, heartburn, irritable bowel syndrome, another condition, IBS, very, very dangerous condition, but it is a functional disorder. But this will create problem for the patient or the person. Then diarrhea, constipation, incontinence, dyspepsia, and infant colic. Infant colic is another problem when the mothers or the family members will be worried about it, and they will go for anti-worming treatment or go for the some sort of digestive treatment with digestive enzymes, etc. Then factors responsible for development of these disorders. What are the factors responsible for developing the functional disorders? Maybe due to one or combination of the following. See, I am given a list. 10 conditions are given, though this is not all. These are not all. There are some more, but these are important ones. One is stress, a low fiber diet, very, very important condition, low fiber diet, which is giving constipation or one of the main cause for constipation. If we change the dietary habit as I was talking about, then this is one of the general measures to manage so many gastrointestinal, acute as well as chronic and relapsing disorders and very common conditions. Then inactivity, no physical activity, only sedentary life. We may be thinking that if any person will have digestive problem and that person gives history of sedentary life, then we'll be giving always nux vomica. But only giving nux vomica is not enough. If we change our medicine's potency repeatedly, but sometimes we may not get the required results or desired result. We have to tell the patient, you have to have some sort of physical exercise. At least half an hour every day you go for a walk. Brisk walking is very important, or take some sort of physical activities. Lack of exercise. Traveling, this is another important part. During traveling, we get so many diseases related to GI system. Vomiting, diarrhea, then constipation, sometimes pain abdomen, bloating abdomen, excessive accumulation of gas, then appetite, reduction of appetite. Because of during traveling, our food habit will be changed. So these are the areas we have to think and why the condition and what are the changes. This is called lifestyle changes. Then resisting bowel movements. Suppose some person is suffering from hemorrhoids or fissure or fistula, and during going, especially for the piles and the fissure, the painful defecation, due to the painful defecation, patient or the person will not go for toileting. As because person is not going to pass the motion due to pain, so naturally he is trying to resist the movement of the bowel, leading to pain abdomen, leading to constipation, leading to other complications, difficulty in defecation. So we have to make the patient that you should go and you should have a regular bowel training. Bowel training have to be given. Then indiscriminate or prolonged use of laxatives and antacids. This is another factor, very, very important factor. Nowadays, people are going over the counter to get medicine everywhere. Even in the grocery shop, the antacids and the laxatives are available. So whenever any person is feeling constipated or diarrhea or acidity, they are going to have some sort of laxatives or antacids. And prolonged use of laxatives and antacids, there will be some problems which are functional, not structural, but patient is not getting cured. This is called as exciting factors or maintaining factors. So we have to take care of that. Here we may have the, if there is no structural change, nux vomica is one of the very, very important medicine. Even the sulfur is another medicine to give. Iron pills, taking iron pills always giving some sort of constipation. So this we have to give some sort of, whether we have to give a ferrous component or ferric component, to a person suffering from anemia, that has to be decided by us. If absolutely iron pills are required for the anemia. Then narcotics, another area. The narcotics are also producing problems. Pregnancy, during pregnancy, again constipation comes, so we have to wait and we have to take some sort of measures with some sort of changes by giving a low high fiber diet, or to give fruits, vegetables. We have to check the condition. So these would be these are some of the important factors for the development of the functional GI problems or diseases. There are three features of the functional gastrointestinal disorders. What are the three main or cardinal features? Based on these three features, patients are getting some sort of diseases or some sort of conditions which are either hyperactive or hypoactive or altering the functions. One is motility, another is sensation, another is brain-gut dysfunction. These are the three features. Motility is what? Pertains to abnormal muscular spasm and contractions that cause painful symptoms. If the peristaltic movement will be retrograde, or if it will be vigorous, or it will be due to some other obstruction in the intestine or any other condition of the intestine, this will give it abnormal motility and lead to painful condition of the abdomen. Then sensation is when the nerves in the GI tract may be too sensitive to stimuli, causing the symptoms. The sensory receptors which are there, lining they are in the epithelial lining of the gut or the intestine. If they will be stimulated easily by some sort of stimulus, then it will be creating any sensations or the symptoms. Some person is suffering from diarrhea or constipation or hyperacidity once he or she is taking spicy food. That will create, again, another person will be taking the same spicy food, but that fellow will not get the problem suffered by the other people because of the sensitivity to the stimuli. The changes occurs in different way in different persons. So everybody will not have the same thing. We have to have a hypersensitive person. We have to give medicine. Who is not a hypersensitive person, there is no need of medicine, or only alteration of the change of food habit we do. Brain-gut dysfunction, it is caused by a problem with the way the brain and the gut functions. Actually, brain is getting the signals from the gut. Accordingly, the brain will be directing the nerves to take action, either to increase the motility of the intestine or reduce the motility of the intestine. So this is called as brain-gut dysfunction. Then come back to the structural one. So this is all about the functional changes where our homeopathy gets the upper hand. I'll come to the scope and limitation chapter. There we'll discuss where to take care, why not to take care, where to send the person, and then we'll get back the patient once again. Come back to the structural area. What are the structural GI disorders? It can occur anywhere in the GI tract due to a change within the structure. Now we are knowing that gastrointestinal tract, starting from mouth to anus, has got three main layers. One is 3 or 4 layers. If we come from inside to outside, inside there is mucus coat, there is a submucous coat, there is a muscular coat, and then there is a serous coat or the fibrous coat. So 4 layers are there. If we go from outside or inside, doesn't matter. Now, when we'll be discussing about the esophagus or mouth or stomach or intestine, maybe small, large, duodenum, we'll be getting some sort of changes. That is why that part has got a different name due to its structural pattern, due to its functional pattern. So any change in the structure, maybe a change in the epithelial lining, maybe a change in the musculature, maybe a change in the submucous lining, maybe a change in the serous lining. Due to those changes, we'll get any structural changes in the gastrointestinal tract leading to the disease called as structural disorders. Then the gastrointestinal tract does not work properly due to involvement of abnormality. Due to this abnormality of the layers or layer, the gut cannot proper function. Diagnosis can be done by more in-depth investigations. So we have to go, as I was talking now, initially we will have a provisional diagnosis, then we will have a differential diagnosis, because in case of, suppose there is pain abdomen, we may think that it is due to constipation, due to amoebiasis, due to colitis, due to cholecystitis, due to appendicitis. So these are all diseases, or maybe intestinal obstruction. All are conditions giving a kind of a pain in abdomen. Now we have to find out particular pain is due to what condition. For that, we have to have a differential diagnosis. Then we'll come to a provisional diagnosis. To confirm that provisional diagnosis, we have to go for laboratory investigation. That is called as in-depth investigation to confirm the diagnosis. Once diagnosis is confirmed, we'll be deciding for the treatment part or management part. So treatments for structural disorders vary depending on diagnosis, prognosis, and complications. Already I have discussed on this issue, taking the example of appendicitis. Then unaddressed structural GI disorders often lead to worse. If we don't take care of the structural changes or structural disorders of the GI conditions, then in due course of time, it may lead to worst possible condition, which is not going to be reversible, which is completely irreversible. And then what type of treatment as a doctor or a physician to be taken, we'll discuss. Examples of the structural diseases of the gastrointestinal tract, like peptic ulcer disease. Here all are there, gastric ulcer, peptic ulcer. So peptic ulcer disease, gastritis. Now gastritis is very simple thing, but thing is that this gastritis continuing for a long time will give a lot of complications. Then gastroenteritis, strictures. Due to the peptic ulcer, due to gastritis, we'll be getting stricture in future. Fibrosis, stenosis, in case of the peptic ulcer, duodenal ulcer, stenosis of the pyloric sphincter will occur. Or then hemorrhoids, then diverticular disease, colon polyps, colorectal carcinoma, inflammatory bowel disease, IBD. IBD is inflammatory, not IBS. That is functional. Here it is structural because it is inflammation. Under this category, IBD, we will be getting the ulcerative colitis and Crohn's disease. Then celiac disease, as I was discussing about, autoimmune response will be occurring in case of celiac disease. Then anal fissure, fistula, Hirschsprung's disease, where the sphincter will be closed due to nerve supply, due to incoordination of the nerve supply. Arbuck plexus is absent there. So congenital megacolon, that is called as. Then abdominal adhesions. Due to inflammation, there will be adhesion, or after operation in abdomen, the peritoneal adhesion will be there, or some sort of adhesions will be there in different among different structures inside the abdomen. Appendicitis, already discussed. Intestinal obstruction. This intestinal obstruction, most common is intussusception. Then pancreatitis, already discussed. Could be acute, could be chronic, could be hemorrhagic. Very, very dangerous situation. Usually patients are going to be lost. Hepatitis, maybe viral hepatitis, maybe other hepatitis, or hepatocellular diseases, where the hepatic cells are going to be damaged, leading to jaundice, leading to fatty degeneration, leading to fibrosis, leading to cirrhosis of the liver, cholecystitis and cholelithiasis, formation of the gallstone, etc. These are the most important and common diseases, which are the structural diseases. Now, what are the general symptoms of gastrointestinal disorders? Why I am going in this way? Because all these are guiding us for diagnostic aptitude, to consider the pathology behind, to know whether it is structural or functional, and to understand the characteristic symptoms, associated symptoms. I'm going to come later on. So general symptoms of the gastrointestinal disorders. What are the general symptoms? Symptoms vary from condition to condition and person to person. Some symptoms are common to most of the gastrointestinal diseases. What are they? Already list is given, like abdominal discomfort. It could be in the form of bloating or accumulation of excessive gas, as I have taken the example of lycopodium. Then pain inside the abdomen due to so many causes. Cramps, which is another condition. So all are different. Bloating, pain, cramps, all are different situations. But ultimately we are getting discomfort in the abdomen, which could be severe, which could be moderate, which could be minimal. Based on that, treatment part will be given, or which could be acute or chronic. Unintentional weight loss, already discussed. Vomiting and nausea, acid reflux, which is called heartburn. Diarrhea, constipation are both together. Fecal incontinence, fatigue, loss of appetite, difficulty in swallowing, and blood in vomit or stool. This is another serious condition. Blood in vomit or stool. Hematemesis, melena. When it will occur? Definitely there is a structural change, not the functional usually. Common factors responsible for GI diseases. What are the common factors? Already discussed. Now I'm giving in a tabulated manner. Eating a diet of low in fibers. Not getting enough exercise. Traveling or other changes in routine. When we are deviated from our normal routine, we get it. Suppose a person is on the holiday or Saturday or holiday, or in case of a meet or some sort of invitation, will be having some additional food which he is not taking regularly or she is not taking regularly, which is not fit for the gut, or which he or she is not able to tolerate. That is the change in routine or other change in routine in case of diet, giving this trouble. These are the factors. Eating large amount of dietary product, dairy product. That means milk or milk-made products. These are dairy products. Then stress, excessive stress, not drinking enough water, inactive lifestyle, aging. In old age, usually we have seen GI problems are getting more. Then genetic factors are also giving problems. Celiac disease is one of the important diseases related to the heredity or genetic factors. Then resisting the urge to have a bowel movement, possibly because of hemorrhoids, already discussed. Overusing antidiarrheal laxatives, antidepressants, iron pills, painkillers, narcotics, etc. Who are alcoholics, who are taking too much tobacco, who are taking too much spicy foods or iron pills, taking antacid regularly, those who are taking antidepressant. Already, and these are the antidepressant remedies are giving constipations usually. Taking antacid medicines containing calcium or aluminium is also creating problem for the epithelium of the stomach. Pregnancy, during pregnancy, constipation occurs. A few systemic diseases we cannot ignore about it. So many diseases are there, like diabetes or some other diseases. Common risk factors for gastrointestinal diseases. What are the common risk factors? Smoking, obesity, excessive alcohol consumption, overuse of certain medicines, family history, that is heredity, bacterial infections, inflammation, genetics, and mental distress. Now, prevention of GI diseases. How to prevent? Already discussed by taking example of, these are the way we can avoid. Eating a healthy diet with fruits, vegetables, and the proper amount of fibers. Getting quality sleep. Sleep is another important factor. If we don't have night watching, recurrent night watching, or regular night watching, or frequent night watching, will give some sort of digestive disorders or acute condition of the abdomen or GI tract. Again, we'll have nux vomica. We may give some other medicines. Getting quality sleep. Then staying hydrated by drinking enough water. Limiting stress by practicing stress reduction techniques. Regular physical activity. avoiding the use of alcohol, tobacco, non-steroidal anti-inflammatory drugs, NSAIDs. Diagnosis of GI diseases, already discussed, but we are now giving in a chart, very widely depending on the type, cause, severity of the condition. Detailed case history is one of the very important factor, which I have already discussed. Tests to be done, exam of blood, stool, USG, endoscopy, colonoscopy, and ERCP, endoscopic retrograde cholangiopancreatography. So ERCP is one of the important factors or important tests to be done to find out. There are some other investigations also, like CAT scan also, or CT scan also can be done. Now, this is all about the GI diseases, acute, what are the types of the diseases, what could be the features, what could be the factors resulting in that, how to prevent it. All these things we have done, how to diagnose it, everything is done. But now I am entering into our homeopathic aspect. From the area of the actual facts, we are coming to the treatment part in our side. There is a misconception about homeopathy. Everybody says, does a homeopathic physician need sound knowledge of basic and allied or clinical subjects? Whether the investigations are required or conducted for the patients? Do the homeopathic physicians believe in pathology and diagnosis? So far, during the discussion of the disease conditions of the GI system, we have discussed that we have to see the pathology to understand diagnosis, to understand whether it is a functional or a structural disease or type of the condition. But the question comes, usually a misconception is there, as because a homeopath is mainly based on or taking the case and basis of the case taking or the symptomatology prescribing the medicine. Usually, and it is seen that most of the homeopathic doctors doesn't touch the patient. That means does not examine the patient, or they don't go for investigation. So this is a misconception about homeopathy. But actually we need it. It is required. So far, whatever discussion we have done to take a case for treatment in homeopathy, we have seen the importance of pathology, importance of diagnosis. A homeopathic physician does not require a detailed study of the subject like anatomy, physiology, pathology, surgery, medicine, etc. Why it is like this? Why people are thinking like this? People are thinking like this in the sense that as because homeopathic doctors are mainly taking the case and prescribing the medicines without doing much investigations, without examining the patient. So it is a misnomer or this misconception. The common public are understanding that only symptomatology is enough for a homeopath to prescribe a medicine. What type of food do you prefer? Whether you are feeling hot or chilly, patient is hot or chilly, or whether how is the stool? Just like asking some symptoms, they are prescribing the medicine. Actually, this misinterpretation is done because when we take generalities of a patient, both mental and physical general, there we have to ask so many questions which are something different from allopathic system. As a result, people are thinking that the homeopathic doctors or physicians are not interested, or they are not wanting the investigation and examination part. But it is not correct. A homeopathic prescription is determined by a detailed study of the symptomatology outside diagnostic sphere. That is the concept. And that's why there is no need of studying anatomy, physiology, pathology, surgery, medicine. But take it granted, all the subjects are required for a homeopathic doctor to know. Otherwise, we can't. Let me go further ahead with this. What are the importance of diagnosis in homeopathy? Let me see whether importance is there or not in homeopathy. Yes. Number one, it offers a full comprehension of the patient's personality, constitution, and the mechanism of production of the symptoms, both subjective and objective. So without diagnosis, it cannot be possible. Then gives idea of the location or locations, that the pathological changes, the pathogenic agents, the physiological disturbances and pathogenesis. That means the tissue and organs affected, the types, tissue and organs affected, the types and degree of extent, all are there to understand. Knowledge of diagnostic symptoms helps in determining the individual characteristic symptoms for homeopathic prescription. So for a characteristic symptoms, it is very important. Then enables the physician to choose his case for treatment. Scope limitation. Without diagnosis, we can't. Helps to know the locations, nature of pathological changes present, structural changes there or not, as we have taken everything, types of the GI diseases, where it is fitting. So diagnosis is important for that. Helps in understanding the advancement of the pathological changes and to know any vital organs are affected or not. If affected, how to take care of that, what to do for that. Enables the homeopathic physician to plan a general, specific and prophylactic measures. The broad area which is given for therapeutic measures. That means general, conservative and the specific measures. Then under conservative, already we have shown before going to the disease in detail that there is general measures, medicinal measures. Medicinal measures, as we are homeopathic medicines. And specific measures, there it is again operative, conservative, operative, combination of both. So that has to be planned. Then again, preventive measures, that is prophylactic measures. So diagnosis helps us for all these areas. Then what about prognosis? Importance of prognosis. What are the importance of prognosis? Let us see. Enables the physician to determine the probability of cure, the chance of recovery, the possibility of recurrence, the time that will be taken for resuming the normal pursuit. So if we know all this, accordingly we will treat, we'll take the help of other system or specific measures, we'll get the combination of both to prevent the recurrence, we'll take the help of the intercurrent medicines, because the chance of recovery for complete cure, recurrence to be checked like this. Now let us see the scopes and limitations of the homeopathic treatment. Once we are sure about the diagnosis of the GI diseases, then we will get the scope. Where to get the scope? When we, as per our homeopathic philosophy, if the disease power and the medicinal power. Once the medicinal power is more, like dissimilar diseases, following the philosophy where Hahnemann has discussed disease power. If it is more, difficult to cure. If the medicinal power is more, then it is very dissimilar diseases are meeting. Then you know all the three conditions. Then cause of the disease, exciting or maintaining. Both the causes will be giving functional disturbances, GI. So we will take the case. Effect of the disease, pathological changes. If it is reversible, definitely we will take the case for treatment, whatever may be the type of the disease. Irreversible, definitely we will take. But we will formulate the type of the treatment which will be given. That means we will give palliation wherever possible. Then if we get the general symptoms from the patient by taking the history, cure is always expected by totality and by similimum. If uncommon, peculiar, rare symptoms are there, definitely it is another area where cure is expected always by homeopathy. Particular, partial cure. If we get only particular symptom, that means the one-sided disease. In case of that, we have to prescribe. Then partial cure. Common symptoms, which is done in case of the allopathic mode of treatment. Acidity patient will give antacid. Constipated patient will get laxative. Antidiarrheal medicine is given for the diarrheic patient, but we don't do that. For when we get the common symptoms, if we give medicine based of that, then we'll get only palliation, which could be done in case of the reversible cases. Wherever not similar, we don't expect any cure. If the vitality of the patient is strong and elastic, definitely patient will be recovered. If it is lower and elastic, difficult to have. But still we have the scope to treat with palliation. So these are the scopes of any diseases, not only in GI system, but any diseases, these are the scopes. No problem. Then comes to limitations. What are the limitations? We are taking the examples of GI cases, but it is applicable for homeopathic treatment. Limitations where the requirement is there for completely other end. Operation is the only treatment of choice. Acute appendicitis. If patient is fit for operation, send, so that we are not expecting any complications in near future. Patient will be cured. When required completely other end, congenital deformities. Suppose there is congenital megacolon, Hirschsprung's disease. We have to take the help of the other method, that means surgical method. Mechanical, any tumor compressing the GIT, or there is any tumor in somewhere in the pancreas or in the liver, that has to be removed. Otherwise, it is giving mechanical effect. So other surgical aid is to be taken. Surgical diseases, true and medico-surgical cases. True means we have to go for surgical cases or surgical techniques we have to take. Pathological, when irreversible, definitely it has got limitation. Trauma, gaping wound. Suppose there is a wound in the perforation is there in the duodenal ulcer. Perforation is there. Intestinal obstruction is there. We have to have some sort of, or any wound which is bleeding, gastric ulcer, where there is hemorrhagic ulcer, in the Crohn's disease, colorectal carcinoma, rapidly progressing, though it is very slowly progressing. That time, fibrosis has occurred. Pyloric stenosis, so food is not going from the stomach to the duodenum. In those cases, we have to have some sort of measures which are surgical. That's why we have said required completely other end. Then chemical, acid, alkali burns producing secondary action. Suppose somebody has taken acid, alkali to commit suicide or to do something, or unknowingly it has been taken, then some sort of gastric lavage or other things to be done. Poisoning cases, again gastric lavage to be given and other procedures to be taken. That vitality excessively lowered and elastic or static, not elastic, static. In that case, other aid has to be taken. Now, homeopathy gets scope after palliation by other means. In the upper areas, congenital deformities, remove it, then we will take care of the. So, homeopathy gets scopes after palliation by other means. These are a common areas. In this case, hemorrhage is one of the factors. Pain is another factor. When patient is getting collapse due to pain or due to some other GI problem, which is acute condition as per our topic today, or asphyxia is there due to what I should say, or suffocation is there due to not drowning, suffocation is there, dehydration is there. In that case, we have to take the other means, followed by again homeopathy will take care of that areas. So these are the limitations. So as a whole, scope, in short, what we should say, scope available in cases where mechanical cause does not oppose, chemical cause does not oppose, development of health does not oppose, removal or destruction of parts does not oppose, direct physiological effect does not oppose. In those cases, scopes are there for homeopathic treatment. That is our therapeutic part for the GI problems. Again, limitations available in cases or existing of exciting and maintaining causes. If we don't remove it, then limitation. Injury, destruction of the tissues present, ulceration, stone in the gallbladder, or there is Crohn's disease. Those cases, we have limitations. Only we can give palliations, we can give symptomatic relief. Otherwise, we can't do anything as such. Then reactive power of the organism to medicine is exhausted, obstructed, prevented. Then symptomatic likeness deficit. Only 1 or 2 symptoms. We can't help. We can't get the detail about the history. Based on this area, I am going to give you the examples when to treat for the psoric case. If we don't treat it in the psoric state, it will go to the psychotic stage. If we don't take care of the psychotic stage with antipsychotic remedy, it will go to the syphilitic or pseudopsoric state. We'll discuss at last. Let me finish the remaining part. Therefore, homeopathy, the science of therapeutics. Our topic is therapeutics. Homeopathy, the science of therapeutics. A system of scientific constitutional drug therapeutics. So, for treating any case, maybe a GI problem or any other system problem or related to other system, we have to have the best way treatment is constitutional drug treatment. We may give palliative medicine, we may give acute or subacute medicine, but ultimately that will give a temporary relief, or if that will not give any relief, then we have to go for constitutional treatment that will give permanent relief. That is the homeopathy science of therapeutics. So remedy, for that constitutional treatment, remedy or the medicine is selected based on its power to produce a disturbance on health similar to the disease condition. That is why we have to match the symptoms of the patient with symptoms of the medicine. Then more the similarity, better the result. Gives full scope to the prescriber's artistic ability. This is very important. All physicians may not have their ability to deal all the cases. Therefore, you will be seeing that, or we are seeing that most of the cases are referred by the homeopaths. Again, we have seen that so many difficult cases are not referred, or so many surgical condition cases are not referred, but treated by homeopathy with a big, very good result. Then experience and concept, not theory, must decide for and against the therapeutic value of such a method of selection. This is very important. We learn from experience. That is why homeopathy, we say that it is clinical oriented, patient oriented. By proving we get this. That is why this statement is given. Experience and concepts, not theory, must decide for and against the therapeutic value of such a method of selection. So selection has to be based on philosophy, which is prescribed in the organ of medicine. I'm coming to everything. So our target will be, whether it is a therapeutic or for any disease, what all the drugs, when to give, all will be decided based on the philosophy written by Hahnemann in our organon. Therefore, we can come to the conclusion, morbid function of functions and organs, or pathology and pathological anatomy, or sick phenomena is nothing but expressions of the signs and symptoms of a disease. And at the same time, on the opposite side, toxic functions and organs, or pathogenesis and pathogenetic anatomy or drug phenomena is nothing but the expressions, or the expressions are nothing but the signs and symptoms of the drug, which is known by our drug proving. And now the person has come with a disease condition, so we'll make it, we'll get the totality, we'll see the simillimum or similarity, and then we'll prescribe, which is nothing but the therapeutic law. So therapeutic law is nothing but the treatment part for the homeopathic treatment. In our 26th Aphorism of Organon of Medicine, what Hahnemann has said, Hahnemann stated that a weaker dynamic affection is permanently extinguished in the living organism by a stronger one. Did you remember where we have shown you the limitations were exhausted? And in case of scope, we have shown that the medicinal power. So same thing has been mentioned in 26th Aphorism of Organon by Hahnemann. A weaker dynamic affection is permanently extinguished in a living organism by a stronger one, if the latter while as differing in kind, is very similar to the former in its manifestations, which we get from the drug proving. So that point is proved over here. This is the law which is based on our treatment part. We are taking for treating the patient. This homeopathic law of nature and the therapeutic law of nature are synonymous. Based on different natural experiments and observations, similia similibus curenter is the axiom for our homeopathic mode of treatment. Whether we are treating for few symptoms, based on few symptoms, or whether we are treating based on the whole case history. Whether it is a therapeutic way of treatment or it is a full holistic way of treatment, doesn't matter. Actually, both are same. Therapeutic law and treatment for holistic approach, all are same. Again, in aphorism 2 of Organon of Medicine, what Hahnemann has said, the highest ideal of cure is rapid, gentle, permanent restoration of the health, or removal and annihilation of the disease in its whole extent in the shortest, most reliable, most harmless way on easily comprehensible principle. This is the therapy. What we have to do, we have to select a medicine easily. We have to give the medicine which will not create any toxic action. We have to make the patient healthy. We have to alleviate the patient without any harm easily. So within a short period of time, on a reliable way, harmless way, and the way which can be understood by everybody easily. It is nothing but objectives of homeopathic physician. So we need to examine. To do that, we need to examine. To whom we will examine? What is the case? So examination is very, very important. As I was telling, no misconceptions about homeopathy. Why people are thinking that a homeopathy physician doesn't require anatomy, physiology knowledge, doesn't require surgery knowledge, doesn't require pathology knowledge, does not require pathological investigation and diagnostic approach. But no, man, we have to have it, because for highest ideal of cure, we need to examine the case for scope and limitation, to decide when to treat, how to treat, when to treat, how far to treat. The form it has taken, that means whether it is functional or structural in GI cases, as per our example taken. The alteration in function and structure responsible for the same. What alteration has occurred? Growth, ulcer, or any hyperactivity or hypersensitivity, whatever. The cause and disposition to it. Exciting factor, maintaining factor, which are responsible for it. Therefore, we need total clarity of these fundamental issues for treatment. We need to take up the case and we need to examine the case, as I have discussed already during scope limitation. For problem definition means for diagnosis of the case, and for the problem resolution, for planning the treatment part or measurement part, for management part, so that patient will be alleviated. Hahnemann's vision on homeopathic education. What Hahnemann says in 3rd, 4th, and 6th aphorism of Organon of Medicine, Hahnemann has summed up his views on homeopathic medical education to be a true practitioner. What he has mentioned there, to be a true practitioner of the healing art, the physician has to first know what is to be cured in the disease. That means the diagnosis of the case, the stage it has taken, the form and the structure it has taken, change in the structure. So knowledge of the disease in every individual case by unprejudiced observation. The physician has to know the normal function and structure to understand the normal function and structure. This is very important. The first step to have this knowledge, first step require more than formal knowledge of the subject, anatomy, physiology, knowledge of man's place in nature and society, community, because the nature, that means the environment, society, community, they will have impact on the patient. That will again aggravate the disease condition, produce the disease condition, because these are all disease potentials. They are responsible for the miasms, dominant miasm, but not the fundamental, but dominant miasm. Is very important here, because I will be dealing in detail about when to take miasmatic factors, where to treat and when to treat. I will discuss at last. Maladjustment, responsible for deviation in normal pattern of health in an individual. So that is another factor which is very difficult to.
Eva?
Knowledge of functional and structural changes, that is in pathology. Functional and structural already discussed. The second step is to find out what is curative in medicine, knowledge of medicinal power. To understand that, the study of proving and homeopathic, drug proving and homeopathic mathematics is important. To understand the physiological action of the drug, medicine upon cell, that means physiological action of drug, medicine upon cell, tissue, organ system, clinical aspect of the drug, sphere of action, regions affected, particulars, etc. These are required to understand, to know the medicinal power. Without knowledge of this, we cannot apply it for any disease, let it be related to the GI system or any other system. Maybe acute state, maybe chronic state, maybe subacute state, doesn't matter. Or in a complicated state, we have to go with this knowledge. So third stage involves, so once we passed out the second stage, we will go to the third stage, the study of principles and other directions for application of homeopathic mathematics to phenomena of sickness, so that cure takes place. This is the therapeutics. The study of organon, especially the practical part, chronic disease, homeopathic philosophy. Without this, we cannot go for that. The study of mathematics prepared on repertory, because repertory is a subject where the group of medicines are coming under each symptom or signs. From there, we have to have a differential diagnosis of the disease. Then we have to the differential diagnosis of the medicine related to the case. The most similar will be taken care of. Then we have to analyze the medicinal symptoms relation to that of the disease symptoms. Then we will prescribe it following the principles. So on the basis of common symptoms, on the basis of peculiar, cure, rare, uncommon symptoms, on the basis of extension, radiation of symptoms and sensations, because sensations as if very important symptom, that is one of the important symptom, peculiar symptom for us. Radiation, that is another important. There is no, suppose I'm taking an example of it. In case of gallbladder symptom or gallbladder disease, maybe gallbladder stone or cholecystitis, maybe acute or chronic, doesn't matter, or any complaint of the gallbladder. What is happening? We have seen that pain is radiating to the shoulder or the scapular region on the right side. Why it is so? Because inflamed gallbladder will be irritating the right dome of the diaphragm. Right dome of the diaphragm is supplied by the right phrenic nerve. Right phrenic nerve is coming from, or root value of the right phrenic nerve is right-sided C1, C3, C4, C5, C6. So naturally the nerve coming from the cervical region, and naturally the irritation of the right dome of the diaphragm, the pain will be radiating along the phrenic nerve up to the neck or the right shoulder. So this is a common symptom. On the basis of common symptoms as we have made, this is a common symptom for gallbladder diseases. But if after investigation, it will be clearly seen that gallbladder is not structurally changed, or there is no structural change in the gallbladder. There is no cholecystitis, no stone formation or any other pathology. Cholestasis, nothing is there. But gallbladder is functioning normal, but pain is radiating from there. Then chelidonium is the drug. It has to be prescribed and will get a very good result, provided if the diagnosis and the investigating results are clear to us. This is called on the basis of extension, radiation of symptoms or sensations. Here is the benefit of these symptoms. So therefore, it is a triangle. We have to take the repertory, which deals with the variable symptomatology, Philosophy is the constant, that means from organon, all the principles which we have already seen, constant, and finally the mathematica, the final court of appeal. So these two areas, repertory and philosophy, will help us to go to the mathematica to select a drug with only few symptoms, a few symptoms, or very good symptoms, or very number of symptoms, but they should be simillimum for the case. That way, it is called as final court of appeal. Therefore, what we should say, integral pedagogical paradigm is nothing but knowledge of what is curative in medicine. That means proving toxicological mathematica pura. And from knowledge of what is to be cured, that means sickness or the patient or the condition, maybe GIT. Then homeopathic philosophy, organon, giving us. What is giving us? Organon is giving the principles, how to use these symptoms to get a complete symptom by location, sensation, modality, concomitant, time dimensions. At the same time, general is mental, physical, uncommon, peculiar symptoms if we are getting, as I have given one example just now with the gallbladder case. So these are the philosophy coming from organon. Then general management and the removal of obstacles to cure. If there are any factors maintaining or exciting causes, we have to remove that. On the other side, homeopathic repertory is giving us a group of medicines. Already I have shown in the previous slide. From there, we are getting the applied mathematica, final court. Based on these two, definitely will be expecting the cure, provided drug is similar, maybe few symptoms, maybe with many symptoms, and removal of the obstacles, that means maintaining and exciting factors, elements from are removed, then we will expect the cure. So these two factors will go side by side. That's why for the management part, in general, we have taken two areas. One is medicinal management, other is general management. Now this general management will be different for different diseases, but medicinal part will be medicine, which will be selected based on the symptomatology, analysis of the symptoms. So this is called integral pedagogical paradigm. Therefore, functions of a trained homeopathic physician, what could be for any treating any disease? Number one, what to look for. Now I am summarizing the whole issue. What to look for, where to look for, how to look for, to develop an understanding image of man in his health and illness. Because what to look for? Case. Where to look for? Area. How to look for? By history taking, by investigation, by examination, everything. To develop an understanding image of man in his health and illness. Of course, we have to consider the environmental factors also. Now, to match this with the known images in homeopathic mathematica till he finds an exact replica, the simillimum. Just now, what we are showing earlier, exact simillimum. What is the aim for that? Aim is to match the patient portrait with the drug's portrait. That is the therapeutics. Maybe in case of the GI or maybe in case of any other system, it is to match the patient's portrait with the drug's portrait. In practice, the mathematica help the physician to synthesize the possible drug portraits to match with that of the patient. It is thus an aid to remedy diagnosis and or to prescribe the simillimum. These are the aims. These three are the aims for a trained homeopathic physician. Therefore, a physician with his knowledge and experience establishes similarity between natural disease and artificial disease, which we have already discussed long back. Now we are telling that person, natural disease affected by natural disease, and the signs and symptoms which are artificial disease by drug proving. Mathematica will be matching both of them. And finally, we are getting what you know, law of similars. This is all about the remedy. So this is the physician with his knowledge and experience establishes similarity between natural and artificial. This is the therapeutics for any disease. any condition, functional, structural, elastic, non-elastic, reversible, irreversible, we have to judge with that. So, I just 1 minute, again, I have to go back. Sorry for interruption, I have to go back with few slides, last few slides. Yes. Here is the, just give me another 5-10 minutes. Here is the mode of homeopathic treatment. As I told you, I have explained everything, therapeutic part, how to deal with that. But now the area which I am dealing with, this is something based on principle of homeopathic practice, mode of homeopathic treatment. I'll read out and all the points have been given one by one. I'll show you, and if required, I'll explain to you. Hahnemannian homeopathy emerged as a rational art of medical therapeutics at the end of 18th century in Germany. Since then, it traveled far and wide through Europe and America. By the beginning of 20th century, it was nurtured in India, and from there it spreads to the neighboring countries. That's what when you are abroad, you are seeing that there are so many people practicing this. Today, it took strong roots as a scientific system of healing art, well accepted by all. And this homeopathy has its own and unique philosophy like law of similars, potentization, dynamization, and individualization. All these distinctly differ from the concept of modern medicine, for which their approach to curative treatment differs. That is why modern medicine, they give antacid in case of acidity. They give laxative in case of constipation. They give antidiarrheal drug in case of diarrhea, but we don't do that. We take the case, we make the symptom similarity, do the totality, analyze the case, giving the medicine. So there is a hell and heaven difference between the mode of treatment in both sides. Modern medicine arrives at a diagnosis and identifies the causative organism, and unless the pathophysiology is understood, no curative therapy can be employed. Without this, they don't give. Suppose in case of the COVID, take the example of COVID, though it is not related with the GI system, but again, one of the symptoms of COVID was diarrhea or gastric derangement. So without having the test of COVID test, rat test, or maybe RT-PCR test, once it is not diagnosed, they will not give the medicine. They will give a line of treatment, common protocol. They maintain a common protocol to give the treatment. But once it is established, then they give the medicine. I'm not mentioning the name of the medicine. Now it is known to everybody. So here is the difference between them and us. On examination of the older literature in homeopathy, suppose if you go to read the old literature in homeopathy, which are there already there with us, particularly in respect to therapeutics, here is the point I wanted to highlight. In respect to therapeutic, it is seen that the presentation is not very different from that of modern medicine. Take the book Lilianth, Dewey, or any other, I am giving mention. The style of presentation in the therapeutic books of Lilianth, Ryu, Dewey, Tyler, and many others is based on the nosological classification of the diseases. If you open the book, you will be getting that only the common symptoms of the diseases are given under each and every drugs. It is not the homeopathic practice. I am not criticizing those people. I am not criticizing those manuscripts, those books which are available. But one, I can say that the reason for such a style could be that these authors were from modern medicine and were converted to homeopathy. Therefore, they always will have an idea to go for diagnostic aptitude, to find out the etiology and pathophysiology. Based on that, they will treat. That's why they have written the therapeutic books on that line. As a result, the logic of homeopathy was not reflected in their presentation in those books. I'm sorry to say, but you go through the book and see whether I'm wrong or right. You will get the truth. In order to facilitate the selection of a remedy, such a style might have been necessary at that time. But now the situation is different, and the study of anatomy, pathophysiology, applied mathematics, and homeopathic philosophy are integrated one, as I have shown few slides earlier, you have already seen. Therefore, homeopathy is a patient-oriented science. It is not a theoretic science. We must pay more attention to the expressions presented by the patient, which are very characteristics to an individual. That is called individualization, which is one of the basic philosophy. I have shown you the basic philosophy in the very beginning. So we must pay more attention to the expressions presented by the patient. Expression means the symptomatology, which are very characteristics to an individual. I started with the expression in the very beginning of GI symptoms. Patient is influenced by his inborn susceptibility and heredity from his intrauterine life from the time of conception. The fundamental miasm, which everybody has, is inborn. It is hereditary in origin, and it is actually came from the time of fertilization onwards. Patient is continually subjected to environmental changes on impact of environments or variance of environment. These environmental changes will have an impact on the patient. Therefore, the dominant miasm comes. The changes of the symptomatology comes. In the process, his susceptibility gets modified and recognizes his traits, character, and qualities. We recognize it as his constitution. That is the reason always we consider constitution of a patient. What is the constitution? We study the constitution of each and every patient. We study the constitution of a drug, which is written or which is observed by giving drug proving. Any change in the internal milieu reflects outside through signs and symptoms. Internal derangement will give the signs and symptoms with reference to the constitution. Change in constitution will give. Therefore, these expressions differ from one another. Concepts of individualization, though nosologically the disease condition may be the same, but expressions differ from one another. That is why we don't consider nosological classification of the disease. In order to understand the internal disorganization, one must correctly understand the symptoms expressed by the patient. The physician must see that these symptoms are complete in all its aspects, that is location, sensation, modality, their causation, duration, extension. This is very important, I have already mentioned. These symptoms must be viewed through Hahnemannian pathology. The pathology which is taken by Hahnemannian way, or the analysis which is done by Hahnemann, is something different from the analysis done by modern medicine in the pathological aspect. Hahnemann analyzed the symptoms of the patients through miasmatic expression. We see through miasmatic expression. Let us see, pathology is an evolutionary phenomenon. That means it will be progressing from one set, functional to structural, structural to complicated one, standstill way, reversible to irreversible way. This way we have to analyze. That is called Hahnemannian pathology in our philosophy. It travels from functional to structural changes, in other words, from SORA to psychosis to pseudo-SORA and to syphilis. Hahnemann has given more importance to this spectrum of symptoms which help to identify the disease state and its prognosis. Hahnemann was not in favor of calling these conditions by name, but was very keen to know the evolution of these expressions. Knowledge of various expressions are very much important for us, very much important for correct understanding of internal condition and the progression of the disease. This helps to correctly identify the pathology for the selection of a similar remedy. This also helps to understand the prognosis and curability and the non-curability so as to determine the line of treatment and regimen. This is very important for any disease. Therefore, while treating any case of individual GI disease, come back to the GI system, like pain abdomen or GERD, gastroesophageal reflux disease, dyspepsia, bloated abdomen, constipation, diarrhea, peptic ulcer, etc. The entire gastrointestinal or digestive system should be taken as a whole. Only will not focus to that area. That is called holistic concept. This is very important for us. Diseases of GI system can be identified by the common symptoms of the system like abdominal discomfort or bloating, pain, cramps, which is already mentioned, vomiting, nausea, acid reflux, diarrhea, constipation, loss of appetite, blood in stool or vomit or stool, which are the characteristics expression. These are the characteristic expression. Each expressions are to be seen through miasmatic cleavage. Very, very important area, miasmatic cleavage. As for example, abdominal discomfort, bloating, pain, cramps, or acid reflux may be due to hyperactivity, hyperstimulated state of the gut, or infection by viral or bacterial or parasitic or allergic condition. May be due to some physical or chemical substances, irritation by that, or by environmental conditions in origin, and is often a fundamental phase and therefore soric in nature and state. So functional changes are mostly soric. If these hyperactive or hyperstimulated states will not be treated in time, then it will be adverse in inputs and takes place, resulting in inappropriate and ineffectual aberrant immune response, causing insufficient metabolic adjustment and in identified as psychotic stage. It will travel to the psychotic stage. This stage results into expression like tardy metabolic process. So naturally metabolic process will be changed and wandering spasmodic response or cramps and colics will be developed. Remote non-responsive inflammatory processes will occur. With continued adverse inputs, this indolent system with its aberrant hypertrophic and target cell response makes a last ditch effort to come to normalcy with increased activity and in course of time goes into debility. Patient will be going into deteriorating. But if the same condition continued without being treated through proper antisoric remedies like aconite, belladonna, bryonia, or whatever antisoric medicines are there, then the phase will progress. Secondary infection or bacterial or any other origin may complicate the condition and the case will move to psychotic phase. So soric to psychosis. Simple abdominal discomfort, acidity now becomes congested with severe cramps and colics, vomiting, nausea, diarrhea, constipation, fecal incontinence, fatigue, loss of appetite, etc. will be there. If this will continue untreated by antisoric drugs like Ipecac, Natron-Sal, Thuja, Medurinum, etc., it may progress into deeper pathology of the GI system, causing hematemesis, growth, melena, etc. Though initially this phase can be reversible, but later on it may run into reversible phase with residual effects in the GI pathology like ulceration, fibrosis, obstruction, etc., and of non-healing in nature. As I have shown in scopes and limitations, that is explained over here in a detailed way, taking the miasmatic analysis of the case through Hahnemannian pathology and the way we look after pathology. If this phase is missed out without treating, then the patient runs into syphilitic phase, where reversible is practically impossible. Drug like mercury group, Cali group, Hipersal or Hyper, etc. may help to stop further progress of the condition, but may not be able to cure, and only palliation shall be possible. Because we have seen that irreversible case palliation is given. Therefore, it is clear that unless these phases are recognized in clinical practice, a correct prognosis cannot be made. Again, if the expressions are stimulation of reticuloendothelial system, presenting hypertrophic induration of glands, chronic inflammation, easy suppuration and delayed healing through fibrosis, reduced resistance to tubercular infection, debility follows fast with continued hyperactivity, then the patient is in pseudosoric or tubercular state or phase. Accordingly, we have to treat with anti-tubercular medicine, almost like tuberculinum, bacillinum, etc., sulfur, like this. Almost all the polycrest remedies are multi-miasmatic in their expressions. Almost all the polycrest. The physician needs to identify this fact and employ appropriate remedy at right point of time. Our therapeutic approach should be therefore clinically oriented, not based on other area. Let us take for example of the condition, pain in abdomen. I'm giving example of that in clinical oriented therapeutic. Why? A condition, pain in abdomen is sharp, cutting, boring, as if squeezed in a vice, relieved by bending double and by hard pressure. This is a condition. This condition diagnostically may be simple colic, excessive accumulation of gas, or amoebic colitis, or appendicitis, or cholecystitis, or anything else. However, how often we prescribe colocin, bryonia, McPhos, etc. in such condition? How long? To give palliation? That is the reason we have to take the case in detail. We have to find out the cause. We have to see the pathology. We have to see the stages it has there, whether psoriasis, syphilis, or psychosis. Accordingly, we have to select the medicine, required intercurrent medicine to be given, we give. Acute stage may acute will be giving. Our Medramedica is unique. There is one remedy for many diseases and many remedies for one disease condition. A small group of remedies will always point to a condition in question. It is on a very rare circumstance that the remedy indicated would be totally different from this group of closely related remedies. So in conclusion, we take a fresh look at the subject. That means therapeutics of the acute gastrointestinal disorder. To understand the patient symptoms complex, we have to understand the patient symptom complex. To see this complex through Hahnemannian pathology, I am summarizing the whole discussion as you have done. This is the essence of that. To identify the state in which the case is resting. Psoriasis, syphilis, psychosis, reversible, irreversible, whatever it is, functional, structural. To identify the remedies having a close resemblance and affinity. We have already shown no Medramedica, philosophy, repertory, everything. And finally, to identify priorities of these remedies found useful in the curative treatment in practice. Which is curative? That is very important. Therefore, to conclude the session, I should say practice is action. Practice evolves out of experience and learning. Education seeks to provide the right situation, show that requisite database, concepts, skills, judgments, whatever we have dealt from the beginning of my discussion, evolved in the learner. Education seeks to mold and must understand the patient with total clarity. Total clarity is only possible in conceptual level, never at descriptive level. A clear concept, effective in understanding health, disease, and recovery. Inadequate clarity at this fundamental level reflects on adequacy of education, be it general, medicinal, or homeopathy, whatever may be. So this is the ultimate conclusion about my discussion. Thank you. Thank you. Thank you.
Thank you, sir. Thank you very much. This has been an extensive presentation and definitely an enlightening and enriching experience. What we expected is a business lunch, and you're given served as a buffet. So you have
definitely, Dr. Alphonse, actually, you see, all the medicines indications are known to all of us.
Yes, exactly.
So we practice it with those medicines. We practice with these medicines. If we get nausea and vomiting, without thrust, clean tongue, salivation, whatever may be the condition in the GI system, Ipecac will be the first indicated medicine. We know it.
Yes.
If there will be frequent ineffectual desire for micturition, defecation, acidity, constipation, diarrhea, nux vomica is the drug. Provided ailments from night watching or spicy food or debauchery life, this is known to all of us. Therefore, I have not gone to differentiate the drugs. I have given the group of drugs, but the mode of prescription based on the homeopathic philosophy, which is the therapeutic base, I have given total discussion on that. So I have tried my level best to compile the homeopathic principle with mode of prescription and the broad outline about the measurement or the measures taken for treating the GI disorders. That was my.
Definitely. You have definitely polished our brains now, our skills, because we all have tools, but we don't know when to take what and when to use what. So definitely you have enumerated everything, possibly have covered every possible condition in GIT and addressed every with the differentiation, of course. And of course, the homeopathic philosophy part, which is very important to how to apply and when to apply. So this has been very extensive. And as a clinician and academician, you have proven your mettle, and you have definitely, we will be expecting you much more from you. And it's been our pleasure and gratitude to you to have you this afternoon. If any questions are there, maybe quickly we can, because I don't think you know you have not left any scope for any questions, because you have covered everything, unless medicines we don't have to deal with. So I think anybody, maybe 1-2 questions we can take, or we can.
Okay.
Yeah. Yeah.
Good afternoon, Dr. Gautam. I'm Shaji, 4th batch. You remember me or not? I don't know.
Yes.
Sir, I am in Oman there now. Sir, a wonderful session, sir. I don't know. That's the knowledge is just flowing out like a tsunami, I can say. So it's it's a beautiful session. You have just taken us from 30 years back where we were in the class, no? So one session, sir, and no, as Alphonse was saying, there's no, there is nothing, no doubt to ask. This gone. Most of things have you have covered, and it's really, it was a beautiful session. Really, it is very much informative. That's all, sir. How are you, sir? By the way, keeping fine?
Fine, no problem.
Yes,
and I hope that I'll be fine also in future.
Oh, sure, definitely, sir.
That's good.
Thank you very much for the session.
Yeah,
sir.
if there is no question, maybe you can wind up now, and maybe we can 5 minutes you can keep. Those who can leave, they can leave after the session. We can have little chit chat also. That's fine. So I would like to thank, and I would thank Dr. Vanita for being the presenting and anchoring the presentation today, and hand over to Dr. Vanita for the closure of the session.
Thank you, Dr. Alphonse. And Dr. Gautam, thank you very much for this extensive learning session. Really, I mean, the stress you gave on the importance of diagnosis was really a very important take home from this lecture, because like you said, they say homeopathy, what is the importance of diagnosis in homeopathy? But this clearly showed how important diagnosis is. So thank you very much for a wonderful session. I think we will now close the session, and we will announce the date for the next webinar, which we will try to have in the end, as usual, in the 3rd week of maybe not in July, but in August, because we've had the beginning of July this year. So our next webinar will probably be in end of August, but we will keep everybody posted on the program. And we look forward to seeing you all there. Have a wonderful summer, everybody, and we will catch up. Bye.
Okay. Thank you.
Okay. Thank you, everybody. Thank you.
Thank you.